Hello, everybody, and welcome to Dentistry Beyond the Numbers. So excited again. My name is Dr. Marc Liechtung. This is sort of our pre-holiday discussion. It's not going to be a full-blown podcast today. We have some holidays coming up, and it's a very reflective time, but we'll get into that shortly. I know we discussed last time, to catch you up, that we're going to be talking about deep diving the super generalist, the Dental Hamsa, the hand that we use to guide us through our career, to be great doctors, enjoy our profession, have a wonderful career, and be great clinicians. It's very simple. And my emphasis on this whole program is to tell you that it doesn't have to do with, the marketing. It doesn't have to do with handing out flyers. It doesn't have to do with how nice your office is, although everything matters. The most important to me is us doctors. I take responsibility in my office for everything. Everything. If we're not up to date on something, if the lab is not missing, yes, there's somebody who's responsible, but it's my obligation and my responsibility to put better systems or work with my team to put better systems, because I look at myself as a super generalist. Little tidbit of what I came up with this week and what I've encountered. It's incredible how the scope of knowledge in dentistry means everything to us producers. Case in point, a year ago today, I have a wonderful, lovely, fantastic man, a dentist that I really would put all my eggs in his basket. He's just an absolute head to toe, what we call, lack of a better word, there's a word called mensch, there's a word called gentleman, there's a word called professional. A year ago, he produced something in the neighborhood of about $55,000 to $60,000 in a month. Great month, right? To some people, that's a great month. But remember, when I drill down to that hourly production and then drill down to the 5 concepts, the 5 procedures that make us great, this young man through the years and just said, Doc, I'm yours. Take me, train me, I want to be great. And he also told me that he's having some issues. $60,000 a month is great money, but if you think about a 35% associate, makes good money, but kids, family, school, you're strapped. I said, listen, Doc, come on my journey. I guarantee you'll look back at money and say, I know it's coming. That's the beauty of what we can do. Our ability to be great is in our hands. It's not in anybody else's hands. We're not going to knock on the door anymore to the principal, to the teacher, to anybody else and say, hey, I need help. We look and embark, and what a great time of the year to do so. This doctor this past month produced, sit down everybody, please listen. He is embarking on $135,000 a month. The man walks, loves, eats, sleeps dentistry, and loves his family. And the greatest joy that I've had in a long time is when a doctor turns to me and said, Doc, I can't thank you enough, because I don't have the stress I had a year ago. When you're producing $1.5 million a year, you don't have the same stress when you're producing $600,000-700,000 a year, 100,000. It's not all about money. I keep drilling it back, going back, saying it's quality, its ability to speak to patients with dignity, respect, and its ability to have a team that reflects that aspect of the doctor in them. And they present the cases to the patient. And you too can embark right now, start now. I'm not selling a program, maybe I will, but right now, look at your local, call me, text me, message me. A lot of you have, and I love it. I love that you're embracing what I'm saying. But honestly, this is what you need to do. This $130,000 a month, $100,000 a month is not going to happen by us not doing it and waiting for it to happen. We got to get better at the procedures we are weak in. Whatever your weak spot is it your belly, is it your arms, is it your legs, go work it out. Oh, here it is. Whatever your weak spot is it extractions and bone lifts? Is it root canal? Is it clear aligners? The gentleman that generated $130,000 plus a month increased his ability to deliver clear aligners, root canal therapy, and implants. And when you're doing 2 or 1 or 0 clear aligners a month to 7, 8, 9 clear aligners a month, when you're 0 implants to doing 6 to 8 to 10 to 12 implants, you are a soaring lion. And that is a super generalist. And that is what it's all about for me. For us in this dental podcast called Dentistry Beyond the Numbers, I'm Dr. Marc Liechtung, and I'm here to tell you that it's all about one thing. You could read journals, you could talk to bigger marketers, you could paint your walls white, you could change your chairs to red, but it's the power of knowledge. You open a journal, you look online, you have so many aspects, so many sources, so many levels of knowledge, beginners, intermediate, and the professional. You have so many sources as GPs. If you're with a group, demand knowledge. I am sure they have it. I bring this up while we're working at Guardian. We educate these doctors. And me, if anybody works for me, they are educated. And they are moving towards having somebody that the first 3, 4, 5 episodes or dialogues that they have in a certain situation, they call me, that's knowledge. Now they don't call me about that. They'll tell me about something else. But we need to gain the power of knowledge. The array of armamentarium, the capabilities of doing the procedures we're preaching, right? We talk about clear aligners, root canal therapy, crown and bridge cosmetics, surgical extractions, bone grafting, standard of care, and implant placement. When we're doing that, I keep saying, we're a comprehensive treatment planner. The world is our oyster. And I gotta tell you, once you reach that level, I see it in these docs. I see it in me. I see it in my colleagues. You walk differently. You talk differently. You're a professional. You're an expert. You know what you're talking about because you dove into all these categories, all these procedures. You talk differently. You act differently. Hopefully you have humility. And your procedures that you're doing are so very different. They're so much better. The quality aspect, your loss factor, your redos goes from 5-6% to 2% to 1.5%. Then you start going on a run where you're not seeing anything come back because you're taking that extra step to care, extra step to learn. So what a great time of the year. We're cutting it short because I don't want to have a full-blown podcast launched on the holiday. And I wanted to just keep the momentum going because I think, judging from our great response, I think it's important to let you know we are focused and we are laser focused on this to bring you the best information about building that phenomenal career, that great, productive, loving dental career where you can give your family so much. And when someone tells me, I don't have the same stress, it's unbelievable, Doc. I owe you so much. And I say, you owe me nothing. You owe me nothing. You did it, you embraced it, and you succeeded. And this isn't for 1 year. Please remember, once you reach that plateau, what a career. That's every month. Once you gain that knowledge. But today, we're embarking on some, in the Jewish religion, there's some serious holidays, a day of reflection. And, I look back at this time of year, I always do, and I reflect. I just reflect, just personally, I reflect on how I did as a father, as a husband, as a caretaker, as a son, thank God. I also reflect as how I am as a professional. We have so many things and great things, and hopefully we're all healthy. But I reflect on where I want to go this year. God willing, I'll still be a son. God willing, I'll be a husband and a father, and I'll be the best father, and now, for the last couple of months, a grandfather. And I want to be the best I can be for them. And how do I do that? How do I get better? But when I think of my career and I look at my landscape and my future as a doctor who's either fresh out or somebody who needs a career change to really embrace the future growth, I reflect on what my weak spots are. I reflect on what I'm weak at, and I want to get better. Those 2 anterior teeth I referred out, why did I refer them out? I sat on my hands for an hour when I could have been doing $2,000-3,000 worth of work. That extraction and bone graft, I let it go because I felt I didn't want to trough it. I didn't know to elevate it. Learn these procedures. They are not the boogeyman. They are not this is not the scary movie. This is embracing your future. And if you want to become a great producer, look inside now. Don't wait. Don't say I'll get to it. Tick, 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 tick. That's what's happening. Tick, 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 stop. Embrace it. See what's happening. See if you add one procedure and not refer out. See if you get comfortable extractions and bone grafts. See if you can find a clear aligners company that will get you to the promised land of what you want to do by delivering 5, 6, 7, 8 a month. But tick, 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 tick is what's happening while we're saying, what should I do? Do it all. You have one career. These are the ways dentistry has blessed us with the ability to do what we love. And I just want to say that, from my standpoint, for those that celebrate, I wish you a happy and a healthy New Year. The sweetest, healthiest year you ever had. And let's do it together. We'll embrace it together. For those of you that do not celebrate, take this time. Take this time to really reflect right now of what you want to gain in the next year. To me, I want to gain knowledge. I want to gain the ability to knock this out of the park. Walk differently, act differently, talk differently, love what I do every morning, get up with vim and vigor, get ready. That's what I want to bring to you. I'm a positive guy. I want to be up about this. We are going to go from 60 to 130. We're going to double our revenue. And think about it. I'll leave you with this last thought. As we're reflective today, as we're reflective on our career, we didn't increase the marketing. We didn't buy some fancy new machine. We just educated a doctor. We didn't go from a $5,000 to a $20,000 a month spend on marketing. More or less stayed the same. Word of mouth got better. Procedures got more sold, more agreed to by the patient. Less problems, no redos, no coming in with complaints. On his way and on her way, doesn't matter. Embrace it, learn it, and deliver it. At Dentistry Beyond the Numbers, reflect back this time. Grab onto it. Let's all gain this year. Let's all track our growth. And let's do that. And I want to hear from all of you that are doing that. Track your growth. We'll do it together. Here on Dentistry Beyond the Numbers. I'm Dr. Marc Liechtung. Have a great holiday. Have a great weekend. I look so forward to seeing you on the next one. And we are going to knock this out of the park. We are going to grow together. Have a great one, everybody. And thank you very much.